All right, the clock clicked over. So, hello, everybody. Welcome. My name is Colin Fair. I'm a faculty member in the Department of Behavioral Sciences at UAGC, and I get to play host for this session. So glad that you're all here. Just a couple of reminders. If you've been attending other sessions, you've already heard this, but by joining us today, you acknowledge that this session is being recorded and will be shared with TLC related materials. So your microphones will be muted for the presentation, but of course you can participate in the chat, post some questions, comments in there. We do have live transcription enabled, so if you'd like to use it, you can go down to the more icon, the breadcrumb icon down at the bottom of Zoom and click on show captions down there. So I am pleased to introduce you to our speaker for the presentation, Dr. Kevin Gresham. Dr. Gresham recently completed his doctoral degree at UAGC, and he's excited to share with you some findings from his research and what he did on his culminating project. So he has over 10 years of experience in law enforcement, which really, as I was talking to him yesterday, is what inspired his topic today, which is why crisis intervention is needed in law enforcement. So Dr. Gresham's presentation should be especially informative for those current doctoral students in the audience, as he will talk about the content of his research, but also the process he went through to succeed, which I'm always curious to hear about, how others have forged that path and made it to where they are. And Dr. Gresham, he's informed me he's willing to take questions as they arise throughout the presentation. So if they pop up, go ahead and throw them into the chat and we can get those answered as they come up. We'll also try to reserve some time at the end for additional questions. So with that, Dr. Gresham, the time is yours.
Welcome in, everybody. Glad you guys are here joining us today. So we're going to talk about my research, training for law enforcement officers. Is it necessary to provide law enforcement officers with crisis intervention training? Also known as CIT, and in law enforcement's world, it is considered crisis intervention teams. I don't agree with that, but it works. So let's get on into it. So when we're talking about crisis intervention, I did post that question up there in the chat early this morning. What is crisis intervention to you? What's it mean to you when you hear that? Most people see crisis intervention as, oh, someone's in crisis, or it's a mental health, or it could be any crisis. When it comes to law enforcement, crisis intervention teams or crisis intervention is very simple. They deal with mental health cases when they arise, whether it's off medication, whether it is a mental health call, a suicide call. Those are crisis intervention where CIT teams come in and try to handle the situation better. Reason why my research is it necessary for law enforcement training? Because most law enforcement officers do not get crisis intervention training at all. There's a few states, luckily, who has revised their system to where it says, yes, you mandatory have to take this training. Only 7 states out of all of our entire U.S. mandates crisis intervention training to become a police officer. Every other state has a 2-hour minimum of mental health training. So during my time in law enforcement, I got in a situation that I wasn't trained for. I wasn't ready to handle any type of mental health calls. It went badly. I went to my chiefs and said, look, I need some form of training on this. I can't live with myself knowing that I could have done better or if there's training out there. So I found a crisis intervention training Memphis model. And that changed my entire outlook as a law enforcement officer. I took every case that I've had, I utilized that training every time I put on that badge and walked out that door, because not only does it help you deal with people with mental health, it helps you deal with people in general. It teaches you that, I like to call it the word judo, teaches you how to really de-escalate situations, really take a step back and not use force, not try to scream at them, get on their level. Hey, this is what we're doing. So with my research, we're going to go over my specific questions, what law enforcement training is, what is crisis intervention training, And I did all my research on a systematic literature review. It was tough, I'll tell you that now, because I had to get school permission to go further back than 10 years on this topic because there's not a lot of research going on about crisis intervention. It's horrible. And we need more people researching this topic. So when we looked at my research questions, it was pretty much simple. When providing training at police academies and providing CIT training in the field, what barriers do law enforcement agencies encounter? 90% of everything I have found is funding. Law enforcement officers don't have a lot of money for training. It goes into, hey, we rather buy cars, we rather buy bulletproof vests, ammo, tasers, stuff like that, body cams. So continuing mental health training has lately been low on their list, and it's horrible. Second one is, how do the outcomes happen versus CIT training and academy? And then how does it happen outside of academy? Which one would be better? I looked into this because where I came from, most officers will not be allowed to take crisis intervention training until their second year as a police officer. To me, that's one day too late. If this is taught in our academies, you got an officer ready to hit the ground running with every single bit of information and training needed to handle a mental health call. Because, it could be your first day on the job, their first day on the job as a law enforcement officer. Bam, your first call could be a mental health call. You don't know. Dispatch don't know. They don't always screen, hey, is this a mental health call? They don't ask that unless the person calling the phone says, hey, look, Bobby Job's over here threatening to harm himself. Okay, mental health call. They know, but 90% of the times you're walking in blind in situations. So I had to look into the outcomes, what it is versus guys who are getting it in the states that mandate it versus guys like me who had to go out and find this training. And there was a big difference. And then what extent should CIT be mandatory in law enforcement academies? With all my research I have found, what extent it should be mandatory. It should be the full class. It's only a week-long class, 40 hours class, to teach you some good guidelines. You're not going to be an expert. They got continuing training out there. You're never going to be an expert in this field. Unless you keep advancing. And that's what I did. Is I got my doctorate degree in psychology, specializing in criminology and justice studies, because I took this class as it's a great class. I became an instructor for CIT, and it really opened up a whole new world for me within law enforcement and personally. So when we're looking at training, the United States trains all types of people. I mean, from federal to city, little history. It just goes on. We're here to protect the people. And the first police department was established back in the 1844s. And that was the first actual paid police department. Of course, we had what's called the watchmen, things like that. Issues with those guys was you had a bunch of drunken people with flashlights walking around trying to make sure no one's doing anything bad. And every state, the state training are different. There are no national standards for becoming an officer. Versus Texas to Oklahoma to California, training is completely different. The state codes are different. There's no really a national standard say, yes, you have to have this, this, and this to become an officer. The only standard I have found is you can't be a felon just because we're handling with guns. That's the only standard I've found through training to become an officer. So it gets very critical on why we need standards, why we need to start implementing better training, better reform, so we have better officers on our streets who are trained and ready to go, especially in mental health crisis. I mean, it's brutal out there with the rise of mental health going on, and the more understanding we're getting nowadays. Guarantee you 90%, at least 80 to 90% of most law enforcement calls to come need aid is a mental health call, and can be handled as such as mental health call. And the best thing about crisis intervention, it is not to arrest the person. It is to get them the help they need and avoid jail. So the few standards that are set in law enforcement, got to know how to use a gun, got to know your state laws. Custody and control is your how to handcuff people, how to defend yourself. Those are the only true standards that is abroad across each state. Lack of standards does leave out much needed training. I mean, I can't state that enough. When I went through academy, I did 2 years of academy, and I still came out truly unprepared for what I was walking into. Continuing on, more mental health training, like I've been stating, especially I've mentioned CIT. So our CIT training hits a lot of basics, recognizing what a mental health crisis is, how to understand, how to talk to a person in a mental crisis. You don't give them commands. You try to get on their level, nice, calm voices. 20% of law enforcement calls service related to mental health. That number is low. Like I said, it's anywhere between 80 to 90 because the 20% is only what has been reported as a mental health call. Meaning, Billy Joe, Tammy calls on Billy Joe, Billy Joe's harming himself or wanting to harm himself, or Billy Joe's off his medicine. Things like that. Those are where these numbers come from of saying, okay, yeah, they told us this. We can categorize this as a mental health call. And so the numbers always look low because not everybody knows it's a mental health call till it's too late. And that's one of the biggest problems of having officers not trained in this. And like I said here, NSA's practices involve planning. For some more training. So CIT, this is a community-based program. Yes, CIT trains officers, trains first responders to recognize mental health. That's just part of it. You have to, on top of that training, you have to know your community partners, have to know your mental health facilities, have to know your mental health doctors, clinicians, people like that. So when you've got this case, instead of arresting them, it's like, okay, we need to take you to the hospital, get you evaluated, get you the help you need. So knowing the next steps after your training of where to go, who to take it to, who to contact is very vital in your community. And most every communities I've been around, unless you're in the small rural communities, they have mental health people there. Their hospitals got usually a mental health people on staff that's there 24 hours to where to help you out. And knowing that in the training is key, because about your third day in training, CIT training, they're going to send you out. Guys going to do a field trip. We're going to go see the people in your community. We're going to go see the mental health facilities. We're going to tour it. We're going to talk to people. And that's one of the biggest things needed to know. Also, they assist with in-service training. The more training you need, the more you're getting to know these people. Hey, look, my year is coming up. I want to, refresh myself on this. They will help your in-service training, provide assistance with implementing training programs for your employees, and helping you set up a CIT team within your department, your community. And CIT doesn't stop at officers. You got your firefighters who get called a lot to these houses when police departments are busy, or your ambulance is being called first. Whoever shows up first, and normally, hopefully law enforcement shows up first, but that is not always possible. EMS may show up, fire department may show up first. These guys need to be trained in it too. That way, hey, if they're the first ones on scene, they just can't be sitting on their thumbs. At least they can go in there, start talking to people, start really helping de-escalate the situation, and with that training, knowing what to do. It includes dispatchers, coordinators, and law enforcement officers. Your dispatchers need to have this training so they can recognize over the phone, Billy Joe's hurting himself, or Billy Joe's acting funny and doing this, this, and this. They can assume, as much as we hate that word, predict, hey, could be a mental health crisis situation. That way, hey, they can give the officers heads up. Hey, this is what we think could be possibly. So we're giving you heads up. Just be ready because this could be a mental health situation. And that's always good for your dispatchers to know and your coordinators. Coordinators who needs to coordinate these training teams, your higher ups, your higher command, police chiefs, fire chiefs, your whoever is controlling whatever the department has got to have this training as well so they understand and see the benefits of this training. And we need officers, everybody involved in this research and any research, when it, including CIT, because we need numbers. Without those numbers, which for me and my dissertation was extremely hard to find, I had to go back to 1983 when and the mid 80s when crisis interventions first started popping up through the Memphis, Tennessee universities and their police departments because they had a situation, uh, suicide situation, kid barricaded, and they realized at the end of it, after everything was done, it was a mental health situation, could have been handled better. And that's how crisis intervention was developed over somebody's mistake and not knowing. But even today, it's not widely used. You would hear about it a lot. I've met with more CIT trained officers than I have in the past, but there's not a lot. There is not a lot of us out there, and there's not a lot of us who are really good at it. It's fine if you're not good at it, take the training, that's cool. You have your bare basics. You can handle the situation as best as you can until someone who is better than you can step in, but at least that training is there. I mean, it having everybody and developing a plan maximizes the benefits, not just for the department, but for the community. Your community starts seeing, hey, our officers are actually doing good. They're not arresting everybody and their mother. They're actually getting these people in crisis the help they need and keeping in touch with them. And that right there is what makes a solid community and starts having them backing the police officers again. Where, hey, look, yeah, they're not out here harassing us. They're not out here doing this. They're actually protecting and serving our community. Protecting, yeah, burglary, stuff like that. But serving your community is all types of needs, mental health, anything you can think of, that's serving the community. And mental health is one of the biggest things nowadays that it's not going anywhere, people. It's only going to hopefully not keep going up like it has been, but our understanding of it needs to get better and better and better as time grows. So, continuing on, creating partnerships, advocacy, I can never say that word right. Advocacies, organizations, mental health organizations promote program effectiveness. Again, it comes as crisis intervention teams. That team is everybody in your community who can help you out during these crises, who you can rely on. If it's something an officer can't really get a scope on while you're talking to these customers or clients or consumers, hey, who's your therapist? We've heard you got one. How about we give that person a call right now? I'll sit down with you. Here's my cell phone. Let's get them on the phone and talk to them. Knowing those, and especially you're going to get repeat business always. Knowing the person, getting them help, really relies on that training, that de-escalation training, and understanding what this person's trying to go through. We all gone through crises in our life. Mental health, we've all been depressed. We've not always happy-go-lucky all the time. Recognizing that in yourself really helps you recognize that in somebody you're trying to help. That's why this training is vital for everybody, especially when it comes to all our first responders. When I mean by everybody, all our first responders, I believe this training is critical. Writing my dissertation was really rough because of lack of evidence, lack of material, lack of research that is new, which really make this really difficult. We got a network I'm sorry, I'm kind of going everywhere a little bit. Forgive me. If there's any questions out there, let me know. So when we come to this, provisions of CRT training, law enforcement officers, dispatchers, others, safety. That's what I mean. Talking about, let's get everyone involved. Sorry, I gotta remember to hit the button. So these studies here back in 19 and 20 were great studies. They redid their studies back from the early 90s and 80s. Both of these researchers, and it's just really discussing the effectiveness. It reduces incarceration risk by 80%. 80% CIT has that much of effectiveness from the data they relooked at, the new data they went on, and it's less force. Officers lose less force in mental health and crisis situations with CIT training, and that's 80% less force, 80% successful. They're not reaching for weapons. Yeah, they're trying to be safe, make sure everyone's safe, and of course, things do happen and go south. You can't always be 100% effective with any type of training. But crisis intervention training has been proven since the 80s that it is a great program. It's something that needs to be out there. I mean, it's phenomenal. So yeah, about the research, worst research, systematic literature review was extremely hard. You'll see throughout if anyone ever reads my dissertation. It is hard, 2019, 21 and 18. Most of these numbers you'll see a lot. And then I've got some older numbers where I had to get approval. If you're writing your dissertation and you can't find that research, you've got to make sure you get approval to go further back than 10 years because they don't like that. They want new research on it. It was one of the hardest researches I've ever done because of the lack of information. I literally had phone calls with more than half of my researchers on my dissertation be like, hey, look, have you published anything new? Can I get some insight? And they were more than willing to help out and discuss their research with me. And they're always excited because it's like, wow, you read my research and glad you're doing your own on this because it's needed. And so when you're doing your dissertation research, if the person that is still no, reach out to them. You can find them on so many sites. LinkedIn was one where I found several. Um, I forget the other one. ResearchGate was another one that was great where you can connect with the researchers if you're trying to quote them, use their research in a systematic review. They are going to be more than happy to assist you because everyone loves being cited in research. It makes them feel good. It's like, yeah, my research is being used for someone else's research. It's amazing. So, this is what my systematic literature review kind of went over. The benefits of CIT practices in law enforcement academies, law enforcement officers, communication, collected tons and tons of data. It was just amazing. So here are some of the citations that I was using. Abram, Britton, forgive me, I can never get their things. Center of Research for Police and Policy. They were good help on mental health situations and discussing what was needed, discussing mental health, things like that, and where I got a lot of my data for training. As much as I wanted to go deeper into it, my research is still ongoing outside of school. And I put most up here on my citations. See, they're fairly new. Some of them are within the 10-year time period. I think they all are. But let's discuss, dissertation process. You've got during your dissertation, depending on what you're researching, you've got to follow that game plan. You've got to, I use chalkboards, I use maps, hand drawn of where I wanted to start, where I'm going to go. Don't get discouraged. Your PJTs, everything. You're going to have a lot of revisions, and it gets brutal. Trust me, that's where everyone feels like they can't do it and they want to bail ship. Don't. I mean, push through it. You got your advisors there, you got your committee, you got your chair. they're there to help guide you along that process. And I had some great ones. Late phone call at night was amazing. Um, so we'll open it up for discussions, questions. Anybody who would like to jump in, chime, see what we have.
I just wanted to jump in really quick and say that this was such an interesting topic. I was so enthralled, like listening to everything you had were talking about. I have a friend in the field, and I was shocked when you have the statistic for 20% because I vividly remember him telling me that it's well over half of the incidences that they come across have to do with mental health. And as you were talking and discussing how every state is so different and there's no federal essentially policy, I
Mhm.
kind of just on the side did a quick glance at the requirements for continued education for police officers across all 50 states. And my jaw's on the floor. Like more than half of these states don't even require de escalation training, which is so vital to understanding the amount of situations they come across. And even the ones that do, it's like maybe 2 hours per year, maybe 2 hours
Yep.
every 4 years. And
Yep.
I'm really surprised. So this is great research. I'm so happy that you did your dissertation on this is incredible.
Yeah, I mean, when I was starting to look at, I'm in law enforcement, and I'm a law enforcement trainer too. I go out teach at academies and universities for their cop schools, and the requirements in education, like Oklahoma, 2 hours of mental health a year is all you need for continuing education. And I'm fighting with them and the Council on Law Enforcement on them about that needs to be higher. I said, why can't we make crisis intervention a mandatory training program and then every 3 years have them retake it? Because things change, laws change, and it is such a more necessity of having people right off the ground ready to go versus waiting 2 years before you can get this type of training. Um, and it's just yeah, it's very mind blowing. As you said, every state, the requirements for continuing education is so lacking. The most requirements they have is for firearms. You have to
Yeah,
shoot a certain score at least twice a year to keep your badge, but yet, as you said, your friends in the field stuff, most of their calls are mental health. So why can't we switch this up a bit and have more mental health training versus, tactics on hurting people?
100%. I remember him telling me that he learned the most about how to handle a situation as he got promoted, as he became detective, as he continued to work. And you'd think about that the people that are getting promoted are not doing every call. So it should almost be backwards like that. They start at groundwork and how well that's how you get promoted is how well they do at the ground. So it was interesting that he learned the most when he got, up to 3 promotions and then he felt like he could handle those situations.
Oh, I fully agree with that. I mean, I've been there. I've been chief of police, and it's like, oh yeah, as I go up, I get this better training over here. So why can't we just throw all what you're trying to give me now into our academies so everybody has this knowledge? And it is backwards, and I don't agree with that. I'm all about law enforcement reform and better training policies and procedures because it's one of the biggest needs out there, especially, I was an officer during the, everyone's attacking police officers at their cars, at their stops. And I get it. There's a lot of bad officers out there and there's a lot of good officers who want to do good, but yet they're so hindered because they don't have the proper training. And with me and crisis intervention, even though it's a week-long training, that teaches you de-escalation, a little bit more on negotiation skills, recognizing, stopping, taking a moment to recognize what the situation is and how to approach it versus academy training. All right, everybody, run in, do what you need to do, figure it out later. And that's where, this crisis intervention training becomes a mandatory, I feel needs to be a mandatory training across the board for every state. I've noticed a couple departments where I'm at is starting to make it a mandatory training for inside their own academies before they put badges on. I know Austin PD, I mentioned that in my dissertation, that They're the only police department in Texas that mandatories their officers to take crisis intervention training before they graduate police academy, which I gave them kudos. I talked with those guys up there, and I was like, that's a great job. Keep it up.
Good stuff, Dr. Gresham. Thanks so much. Appreciate the passion, enthusiasm, the participation from everybody. We ran out of time. It sounds like we could keep the discussion going. So I did post Dr. Gresham's email in the chat. If people want to keep the discussion and talk a little bit more, reach out with further questions. So be sure to check that out. I also put a link to the TLC conference evaluation form so you can provide some feedback on the session and conference in general. But thanks again, Dr. Gresham. Thanks everybody for coming. Enjoy the rest of the TLC. Take care.
Thank you everybody for joining in. I appreciate it. And you guys go check out some other presentations.